at Sparsh Healthcare and Wellness. Today we'll discuss about very common condition which is tennis elbow or lateral epicondylitis. We'll discuss about what is tennis elbow, what are its causes, what are its symptoms, how homeopathy and physiotherapy help to combat this condition. So what is tennis elbow? Tennis elbow is basically inflammation or a tearing of the tendon that connects the muscles of the lower arm to the bone, and it is caused due to the overuse of the muscles of the forearm, and it commonly affects the 30 to 50 years of age, and it is very commonly seen in the plumber, carpenters, tennis player, basketball players, and even in the housewife who cooks, who uses her muscles. So sometimes the patient will experience a pain here which may or may not be radiate to the forearm. Then there will be swelling here. Then there will be a pain while doing some common movements, like while hand shaking. A person will experience pain, and while lifting or grasping the objects, a person will experience pain, and this pain can radiate to the forearm. So how homeopathy can help? Homeopathy basically helps when a person will experience, say a person will say, I have a burning pain, and some other person will say, I have a stitching pain, and this will aggravate in the warm weather. Some will say this will aggravate in the damp weather. So homeopathy can help to achieve cure in these conditions, and will also lower the recurrence of the tennis elbow. So now Dr. Shalini, our physiotherapist, will tell you more about the tennis elbow and its physiotherapy.
Hello, myself Dr. Shalini. I am a consultant physio at Sparsh Healthcare and Wellness Center. Basically, tennis elbow affects the muscle tendon, that is ECRP, extensor carpi radialis brevis. The patient will suffer pain at the lateral epicondyle of elbow. In this, the pain is mild to severe. In severe cases, the pain will radiate throughout the forearm, and the pain will increases at the night time, mainly when the elbow joint is at rest. Now, what we can do in physiotherapy, there are many treatments of tennis elbow. First of all, in tennis elbow, we can use ice pack. It will decreases the inflammation, and with that we can use ultrasonic therapy, TENS, and wrist strengthening exercises by using wrist exerciser, gripping exercises by using gripping balls or smiley balls. With that, supination, pronation exercises are also important. And in physiotherapy, for diagnosing the tennis elbow, there is a test, most common test, which is called Cousins test, to diagnose whether the tennis elbow test is positive or negative. These are some treatment in physiotherapy. With treatment, we have to also keep in mind about the precautions of tennis elbow. While we are typing, so we use the wrist extensors more oftenly. So what we can do, we can take breaks of 5 to 5 minutes. And we should also avoid heavy weight lifting by the affected arm. Instead of using the affected arm, we can use both the arms. Use tennis elbow band. In tennis elbow condition, how we will wear that band? We have to wear that band in the gap below 2 fingers at your elbow joint, where it is muscle belly. We can use that band, or we can wear that band while working, while cooking, and we should remove that band when we are at rest, especially at the night time. So these are some important information of tennis elbow. If you all are also suffering from this condition, so you can visit at a Sparsh Healthcare and Wellness Center at Moti, Nagar.